is called as Berberis vulgaris. You have already named the remedy, okay? But a little information from the pharmacy part. Berberi is the common name, okay? Berberidaceae is the natural order. See, natural order for a third year student is important, okay? Because there might be few more remedies coming up from this particular family, and probably that's what happens when we group them, and when we study them, that will become the group characters, which is very important. Now, before I go in detail about the remedy, I missed one thing, or you did not ask me which books to refer. I was waiting that somebody will ask me this question. I know, whatever I tell, you'll refer only that one book. Correct, no? That's the reason you didn't touch that point. Boss, you tell what you want. End of the day, we are with that book. Fine? Okay? So let's not look into what that book is. But again, I always insist. If you're serious, if you're passionate about homeopathy, then that single book will not help you. Fine? That single book might maximum help you in your exams, your immediate target. But what should be your long-term goal? You should have a beautiful practice, a successful practice, homeopathic practice. Fine? If you have that long-term aim, then definitely you need to invest in good books. You need to read. See, reading different books, I'll give you the list if you want, that's an investment. Now it might look a little difficult, but when you start practicing, you will feel the beauty. You will enjoy it. Fine? So what are those small books that you need to either buy, or if you can't afford, we have plenty of books, racks unopened in our library. Forget about the books being unopened, even that particular rack is not being opened. There are plenty of materia medica books. Fine? If you can't afford, if you can't buy, don't buy. Please read them. So what are those list of books I am trying to give you? You know few. First, as a third year, see, again, the focus, I repeatedly tell, the focus is third year students. Fine? Must be if you come to final year, I'll have a different presentation. The way you study materia medica in final year will be different. I'll have a few more things I'll be adding. And few more books I'll be adding when you come to final year. Okay? For a third year student, you are exposed to the clinical setup. Okay? So there is something called as clinical materia medica. Done? Like we have Boric, we have Clark, and I have always insisted, my all-time favorite, Dr. E.A. Farrington. Clinical Materia Medica by Dr. E.A. Farrington. A beautiful book. These three books, and second year we have already discussed. You will have to read Kent's, fine? You will have to read Nash, a small book but beautiful book. And one more very important book that you can't miss is Allen's Keynote. Never miss this. For your Viva, for your keynote prescription, is a beautiful book. Allen's Keynote. Fine? And there are so many other authors. First basic you finish this. If you are done with it, then I'll give you the bigger list. But this is very important. Basic books. You also have Essence of Homeopathic Materia Medica by Professor G.V. That's also a small book given in a syllabus. You can refer. Okay? Done? And Fataks, beautiful book. Many of my lectures, they are from either E.A. Farrington or they are from Fataks, the rare remedies. But for a bigger picture, we have Kent, we have Margaret Taylor, we have Philip Bailey, Catherine Coulter, and of course my teacher, myself, I also refer a lot of Professor Vijay sir's books on materia medica, and I will be sharing the knowledge. So mine will be a combination of all this. Dr. Shankaran is also there. I mean, see, as a student you should be open to read all books. Fine? At the end of your degree you decide whom to follow, it's your headache. But be open to read, and definitely they will have their own views and it can help you. Okay? So that was the list of books I wanted to give you. The tincture of the root of berberis is what is used in homeopathic preparation. And we also have the alkaloid berberina is the alkaloid present. Okay, so this is the basic information which for your practice tomorrow may not be very important, but please do have this in the background. Now this is very important. What is this that I am trying to focus here? I am trying to focus on the sphere of action. Sphere of action, very important. A remedy which predominantly acts on the urinary system. Okay? And when I say urinary system, from the knowledge of anatomy, you know it is the kidneys, the ureter, the bladder, the urethra. Okay? Again, berberis has a specific affinity for the kidneys. Though it also acts on the bladder, predominantly you see berberis acting on the kidneys. Okay. So what exactly it does acting on the kidneys? So it can produce kidney stones. Okay. Done. And second very important thing taken from Dr. Phatak's Materia Medica is it can cause lithemia. Now any idea what the term lithemia means? So lithemia means when there is increased uric acid. When there is increased uric acid, old terminology, increased uric acid in the blood, we call it as lithemia. So you know that berberis has an action on the uric acid metabolism. Okay. So indirectly what am I trying to hint? It can be a very good, it can be a very important remedy for gout. Good, I am happy, gout. So other than the kidneys, the second area where you see berberis acting will be the joints. It can cause inflammation, it can cause gouty arthritis, okay, gouty arthritis. And the third very important thing is this, the liver, or I'll use a broader term, hepatobiliary system. Knowledge of anatomy, knowledge of physiology. Now what is the main function of this hepatobiliary system? Yeah, the secretion of bile. We'll not go into the physiological part in detail, but you know the secretion of bile. So what berberis does is it promotes the flow of bile. And if you see this image, I have also tried to take it from Google. What if you just see here is berberis is a very important remedy for gallstones. Fine. So your knowledge of pathology will come in there. Okay. So three areas. One is the kidneys. Second thing will be joints. Good. And third thing will be hepatobiliary system. Hope I am clear. Fine. Any confusion? Anything that you want to be clarified, please raise your hand. We can stop, we can clarify and then move further. So far I think it's pretty, clear. Okay. So we will see. Now what I am trying to do here in today's class, I will be focusing mainly on the urinary system. Okay. Fine. But berberis also has something to offer apart from the urinary complaints. So that I will try to tell you in brief. Keeping the third year's exam point of view, one question that can come up is urinary complaints of berberis. You can take it, 5 marks, guarantee. Okay. But beyond exams, there are lot of other things you have it in berberis. Okay. So we will look at those areas. So I will sum it up under the heading characteristic symptoms. Okay. What is unique, what is peculiar, what is uncommon, we'll try to understand. Done? So what is the first characteristic symptom you have in berberis? You can just look at the image and try to interpret what could be the text that I will be coming up next. What is it that you see here? You see something? Huh? blurry. I mean, at least for me it looks clear. Any problem with the PPT? It's clear. Yeah. No, I was little, okay, chalo. Fine. I mean, see, that's our interpretation. She says it might look blurry. Good. Huh? Hypnotize. Fine. So, through Berberis, I am trying to hypnotize you students. Okay, fine. Okay, I mean, yeah. See, when I ask you what do you understand, I should respect your views. Or I should not have the guts to ask you what is your interpretation. Correct? Yeah. So, with due respect, it is not blurred and I am not trying to hypnotize you. Fine. Now what is it? Very good. There is a pattern. Probably the girl sitting in the front had a better view. So she says there is a pattern. Okay, fine. See, simple thing what you see is there is something that is alternating. Good. There is alternating. Fine. So what I want to bring in here is, in Berberis, you have alternating symptoms. Yenangandre alternating symptoms andre? Okay, for example, constipation alternating with diarrhea. So when one symptom is there, the other symptom will not be there. So 3 days is constipated, next 3 days you will have diarrhea. And again after 3, see here, it is purple, this, and again that. Fine? So that is alternating. One will be subdued, the other becomes prominent. Okay? So what are all the alternating symptoms you have in Berberis? That is the question. Okay? So again taken from Dr. Fatak's Materia Medica, thirst alternates with thirstlessness. They feel thirsty and absolutely no thirst. Fine. So this is an alternating state. And you have another very important thing, hunger alternating with loss of appetite. Increase hunger. Mother will be fed up cooking and feeding him. And then next week absolutely no appetite. And again after a few days excessive appetite. So this cycle, fine, will keep repeating. So pattern, good. So it keeps changing. So alternating symptoms. Fine. So one of the very important remedy for alternating symptoms rapidly alternate. You getting my point? Symptoms rapidly alternate. It's not this week it is there, next week it is there. It is very rapid in alternating. Clear? Alternating symptoms. First. Second very important thing is, again I don't know what interpretation you will come up with, but okay, very good. Admiring themselves, good. Fine, no problem. That's not what I wanted, but anyway. See, okay, what I wanted, okay, very good. Trying to look young, but in reality she's young. She's looking old. Good. Yeah, very good. I'm happy. When she said admiring, I was a little worried. Good, no problem. Yeah, fine. I mean, okay, could be, like, the images can have multi-dimensional understanding. Good, no issues. Individualistic understanding. Fine. So what is very important here is, the Berberis constitution, okay, are those people who look prematurely old. Fine. Men, women who look prematurely old. What do you understand by this statement? Yeah, I know. See, don't tell what I have told you. Fine? See, I mean, the beauty is, so prematurely old, what I am telling you only you are trying to tell me. But what do you understand? What is the application? When do you use this statement, this symptom, tomorrow in your practice? That is very important. Okay? Like, day before yesterday, one of our intern had taken a case in the clinic. Okay? 42 years old man. 42 years old man. The entire beard is white. Hair is not white. Why the hair is not white? Because he has applied dye. You are getting my point? So, the entire beard is white. And I was just looking at his age. He is 42. and I asked him, when did they start? Sir, it's almost 6-7 years. Meaning, some 36, 37, he started with whitening of beard and whitening of the hair. So now what is this? This is premature graying. Fine? And if you look at his face, he looks more aged. He looks, for 42 he looks more aged, meaning he looks almost 50, 52 kind. Now this situation is what we say prematurely old looking. So prematurely old looking. There are better remedies than berberis. There are better, very good, I'll come to it. There are better remedies than berberis in your syllabus. So absolutely right. What was it? Argentum. Argentum metricum, correct. The first line in Alan's keynote, like he says, who are mentally and physically drained. There is so much of mental stress in Argentum that it is showing on his body. He looks old. Fine? There's so much of anxiety, there's so much of anticipation, so much of stress. Argentum looks old. Fine? Lycopodium. This gentleman yesterday, the case I was discussing, we prescribed him lycopodium, right-sided kidney stones, and he came to us with a distension of abdomen. Beautiful case. If you hear that case, if you see that case, whole of your life, you'll never forget lycopodium. Fine? So that's the beauty of homeopathy. So that gentleman was given lycopodium. Lycopodium is a very good remedy for premature graying, premature old age. Any other remedies? You can also contribute so that you'll also feel. Any other remedies that you can think of? You also have remedies like ambragracia. Ambragracia, it's a remedy that will be told later. Many ophidias, especially lachesis, okay, opium, abrotinum, are few remedies who look prematurely old. Selenium, a final remedy. Selenium are few remedies. Please do add berberis, prematurely old looking men and women. It's not only men, it can also be women. Okay? Gandusru, Hengusru, who look old for their age. So, third very important thing, berberis. Pain. Yeah, I've shown the image of joints here, but pains, okay. What is the character of pain you have in berberis? Very important. I have two headings under which I will be explaining. The first thing is, the pain in berberis is more radiating pains. Radiating pains. What do you understand by radiating pains? Pains which extend. Okay. For example, I have pain in my elbow. From here the pain is going down. Fine. I have the pain in my kidney region, and the pain either it is going down to my leg or it is going up. Pain in the gallbladder. Okay. And this pain going to the umbilicus, or this pain going behind to the shoulder or the scapula. So this is what we call it as radiating pain. Any pain in berberis will be radiating. Okay. I have given few examples. Arthritis, I just spoke. It could be gout, it could be lumbago, renal colic, cystitis, neuralgia, any of these pains, and the pains keep radiating. Very characteristic. Okay. Now, I was referring the repertory under generalities, pain radiating, aggravation, standing and exertion. The only remedy we have is berberis. Radiating pains, when he stands or when he exerts, it is more. If you have this situation, the only remedy we have in our materia medica is berberis. See, is the radiating pains clear? Pains which extends. I'll give you more examples after some time. Now the second very important point here is, can you interpret this image? Pains which keep changing. She has pain here and rapidly, or the pains which keep shifting, changing. Wandering pains. We have the radiating pains Now I am talking to you about wandering pains. Pain which keep shifting from one place to another place. Wandering pains. Okay? So pains rapidly change their locality and character. Not only the locality, it is also changing its character. Here I might be having tearing pain. Okay? And here I might be having shooting pain. You getting my point? See, this is how the patients will come to your clinic and tell, Doctor, there's something very surprising, very unusual about my pains. It starts here, and this pain is something different. Then the pain immediately goes here, and this pain is entirely different, doctor. I don't know how it can happen like that. Yeah. Must be a dose of berberis, can do wonders. Okay? So, pains, is this slide clear? What did we discuss in the previous slide? Premature, old age, and before that? Good, alternating symptoms. See, when berberis, if you have to recall berberis, this is how it should come. First slide, it should be a picture, imagination. This is what Sir told. First slide, kidneys came up. Fine. Second slide, he showed the sphere of action. Third slide, he showed a tube light, bulbs. One was ignited, and he meant characteristic symptom. Then this, then that. That should be the way how you should recall. Fine. And trust me, it is worth. It is worth investing your time in the classes. And I promise you, if you study homeopathy correctly, you can do wonders in our clinics. Whether you will think of me or not, that is secondary. But I can promise you this. If you are sincere, attend classes regularly, focus regularly, correctly, you will see a beautiful reflection of this in your practice tomorrow. Okay? So please focus, understand. Any doubts, feel free to ask so that you are clear. And there is no scope for confusion. This year, I don't want to hear the word confusion. Fine? Okay? Now we'll get back. A very important thing here. Any wild guess? Knowledge of anatomy, knowledge of pathology? Huh? Very good, good. Vocal cord. Is this the normal vocal cord? You see something extra here. Okay? So this is what we call it as vocal cord polyp. What is a polyp? What is a polyp? What is the simple definition of a polyp? Polyp is a growth which comes from the mucous membrane. Any growth you can't call it as polyp. So polyp is something very specific. When you have a growth coming from the mucous membrane, then we call it as polyp. Okay? So vocal cord polyp. Only two remedies given in our materia medica. Which is the other one? The other one is tuja. So I was reading Professor Vitulka's Viva, Materia Medica Viva. There he shares a case where tuja was given and tuja did not help. And berberis was given and berberis beautifully clears vocal cord polyp. I had shared a case, I don't know if you remember, one of the webinars, and I had a case of vocal cord polyp. A teacher by profession, and a single dose of phosphorus which was given constitutionally, this disappeared. He had hoarseness of voice. If I repeat the case, it will be repetition because I have already told. But he was almost set for surgery. Surgery date was fixed, everything done. A great ENT surgeon, I'll tell you why I'm using this word, great ENT surgeon. He had all seen laryngoscopy done and huge polyp. And he said, boss, we can't wait, we'll have to operate. And all the operation date, everything was fixed. But fortunately or unfortunately, the college principal, he was my patient. So he said, why don't you try homeopathy? So night 10:30, 10:45, I was forced to see a case. He said, no, sir, he's almost posted for surgery. Please do something. I said, okay, fine, you get in. If I can help, hoarseness of voice, he had stopped teaching, even that case taking, no, he had a lot of difficulties, even to give the case. Luckily, I took the case, even the principal added his inputs, a lot of things we mixed, and the remedy came up was phosphorus. And a single dose of phosphorus, and I requested him to postpone the surgery for some time. Fine? I requested, I didn't tell him, because homeopathy works only if it is similimum. Similia similibus curanter. Fine? Homeopathy works only if it is similimum. Fine? So I requested him, boss, why don't you postpone? He also agreed, we postponed, and 3 months he was with me taking medicines. 10 days, 15 days, voice became very clear. He started taking classes, fine, and I requested him, please go back to a ENT surgeon and get a laryngoscopy done. So after 4 months or 3 months after treatment, he will go back to, it's a beautiful story, he will go back to his ENT surgeon, fine, and from the ENT hospital only he will call me, sir, I want to meet you. I said, boss, what happened? No, sir, I want to meet you. And then he will come back and he will narrate his experience, what happened in the ENT clinic. So that ENT gentleman, he will examine twice, thrice. He will put the tube twice, thrice. He will see his old reports. That boy narrated. It was very beautiful to see. And I used that word, great ENT surgeon. You know why? I had requested, respected sir, this is a case of vocal cord polyp. You are advised him for surgery, he is under my treatment for 3 months. Please repeat a laryngoscopy and give your valuable opinion. Thanking you, yours faithfully, Vijay Krishna. That letter from a letter given. So that gentleman, what he did, on his letterhead, he wrote a letter back. Congratulations, Dr. Vijay Krishna. This big polyp will not reduce with any medicines, even with steroids. I have that letter. Even with steroids. And the entire credit goes to homeopathy. Fine? Beautiful. See, very rarely we have an allopath appreciating, not appreciating me, appreciating homeopathy. And the beauty, this gentleman called me. I become a little, emotional. He called me and he told, same words he told, and he told, next time, before surgery, I will refer the patient to you. And he has already referred 3 patients. See, that's not every, I was lucky to get a man like him, who was so open, and he is top 10 Asia. Asia is only top 10 doctor. Fine? And getting his appointment is a big deal. But see how down to earth he was in accepting the fact that our medicines did wonders, and he was great enough to give a appreciation letter. It's a big thing. Fine? And this case now changed my practice. Why it changed my practice? He is a politician's son. This guy. And trust me, around 100 to 150 patients he has referred. And even now it comes, patients come. Why I am narrating this case here is, see, one good thing you have done. Fine? Because people have heard him speak. And he has also given me a video, that boy, not boy as a man, and he has told, sir, any platform you call me, any seminar you call me, I am coming, with all the reports, and I'll tell you whatever you want me to tell, because unluckily, we could not record that hoarseness first day video, but follow-up videos we have, and he himself has given how difficult it was for him, and after homeopathy, how it has changed. It has changed him, and it has also changed my practice. So many bookings, bulk bookings. 15 days he blocked all my bookings for his relatives, all those things. It's a big thing, right? So, I'm not just trying to tell you, I'm doing something great, but just trying to motivate a third year BHMS student that if you do good, your allopathic friends also will appreciate you. Your patients who are brand ambassadors of your clinic, they also promote. Fine? So have that good will, understand homeopathy, and it will take you to different heights. That's what I wanted to convey with this case. I have not used berberis here, I have not used tuja here. But I have used a constitutional remedy which also has polyps, and it cured. Done? So we'll go ahead. So vocal cord polyp, berberis. Fine. Now this is what I told you under sphere of action. What is this? Hepatobiliary system. Now what will berberis do here is, it is a very important remedy which, see, in person in whom the biliary system is compromised, fine, okay, and they go into gallstones. Giving berberis, what did I tell you? It regulates the bile flow, okay. So one of the very important remedy for gallstones. Now, can you think of the indications of berberis in gallstones? When will you think of berberis in gallstones? There are so many remedies for gallstones. That's what Rakesh wanted, comparison, if I am right. Fine? There are so many remedies for gallstones. When berberis? This is the confusion you have in your clinics tomorrow. Fine? You have calcarea, you have lycopodium, you have cardas, you have chelidonium, you have many remedies. When berberis? You already know the answer, I have already given you the explanation. When berberis? See, if you know what happens in gallstones, how do they present from your knowledge of pathology, then you apply it here and see when. When berberis in gallstones. Beautiful, good, very good. I am happy. Radiating pains. Fine. And pain in the right hypochondriac region going under the inferior angle of scapula is a common symptom of gallstones. Gallstone colic, it's a common symptom. But here the pain can radiate to shoulder, pain can go to navel, the umbilicus. Okay? Radiating pains. One very important indication of berberis. Pain from gallbladder to stomach, not only to the navel, the pain can shoot to the stomach, into the left shoulder, scapula, down towards the navel. So tomorrow you have a patient who comes to you with gallstone and is in a gallstone colic, and when pains are like this, you can think of berberis. Okay. Now moving ahead, is this giving you some clue? I have two images that I have taken. See, this is the image of the anus and anal opening, and you have another opening beside that. What are the abnormal openings called? Very good, fistula. So, anal fistula. Anal fistula which comes after chest operations. Any operation, any surgery on the chest, any surgery. Again, going back to your anatomy, whatever organs are there in the chest, they have been operated upon, and if the patient lands up with anal fistula, the only remedy is berberis. Try to understand. Don't ask me why a person with chest surgery has gone into fistula. I have no answer for this. Fine. But if you have a patient, if you are lucky to have a patient like this coming to your clinic tomorrow, please think of berberis. So, anal fistula after operations of the chest. Or you have one more very important thing. Chest complaints alternates with anal fistula. You have that alternating symptom, no? We spoke. So chest complaints iddaga fistula will be dry. Okay? When there are no chest complaints, fistula will open up. So this is alternating. Chest complaints alternates with fistula. One. Chest complaints accompanied with fistula. Only remedy is berberis. What is the difference between alternating and accompanying? Accompanying means it is there. It is there. This is also there. That is also there. So this deadly combination, only remedy is berberis vulgaris. Chest complaints accompanied with, what is it? Fistula. Where fistula? Anal fistula. Not any other fistula. Specifically anal fistula. Okay? Done? Yeah. We'll go ahead and chest complaint accompanied with this thing. Okay. Now, what is this that you see here? What happened to the color? It's turned yellow suddenly. At least we are not talking, just because we are talking of a liver remedy. But now anyway, see what do you see here? Bubble, very good. So I don't know, this bubble reminds me of a small incident. Have I showed you any time before? No. See, once it so happened, a primary teacher, she joined school for the, not primary, high school teacher. She joined school for the first time. What will the teacher do when she joins for the first time? Very good. Introduction. So she starts with boys. And she starts with boys, meaning introduction. Right? What is her name? One boy stands up and says, "Ma'am, my name is David." Good, fair. And David, what are your hobbies? "Ma'am, I like to see bubble." You understand? I like to see bubble while bathing. Then he will sit down. Second, "Ma'am, my name is Joseph." Good. And Joseph, what are your hobbies? Joseph also has the same hobby. Joseph says, "Ma'am, I like to see bubble while bathing." Then Naresh, Ramesh, Umesh, Vijay, Krishna, that Krishna, all boys. Boys, different names, but same hobby. Madam will be worried. Then the girls will start. One girl will say, "Ma'am, my name is Rosie." Okay, good. Rosie says, "My hobby is to do gardening." Okay. Then Venkat Lakshmi, Mun Lakshmi, this Lakshmi, all girls will come out. In the end, you have this beautiful girl who will stand up and says, "Ma'am, good morning. My name is Bubble. And my hobby is to take bath 3 to 4 times a day." Okay, I don't know how much I understood, but anyway. Anyway, yeah. No. We'll come back. We'll come back. Okay. So what I was trying to tell you here is, see, at least the word bubble, apart from the joke, what you need to remember is bubble or bubbling sensation. Yeah, relax. I know there are few who would have understood the joke late. With due respect, we'll come back. It used to happen during our college days. We used to tell some joke to the girls and they would laugh in the bus. See the transformation. See how much of baretas they are. Just to slow. Okay, anyway. Yeah, we'll relax. We'll come back. You want to have a small break? See, this joke was a break for you. So that you just laugh and you come back. A lengthy class, focus might become a little difficult. But jokes should not take away the focus. Right? Okay, we'll get back. Bubble, sensation of bubble. Okay. Now this is very characteristic in berberis. Now what is that bubble sensation? If you read E. F. Harrington's Materia Medica, he says, a feeling as if water is coming out of the skin. A feeling as if water is coming out of the skin. Bubble. So this bubbling sensation in berberis, they have it in the kidneys. Okay. So sensation of bubble as if water coming out of skin. So these were few characteristic symptoms of berberis. So we'll have a quick recall of the what characteristic symptoms. What was the first? Alternating symptoms. Good. Second, they look prematurely old. Third, pains which are radiating, pains which are wandering. One kade and ಇನ್ನೊಂದು kade, it keeps moving. Vocal cord polyp. Good. Vocal cord polyp. Yeah, its action on the hepatobiliary system, where it causes gallstones. Good. Then anal fistula alternating with chest complaints, or anal fistula, chest complaints accompanied with anal fistula. Very good. And then we also saw, what is it? Sensation of bubble. Good. So these were the characteristic symptoms. Fine. Now we'll focus on the area that we often use berberis in our practice. For you, this area is also very important as a third year student, and for practitioners and for the seniors, this is a very important area. Okay? This area is something that we have all explored in berberis, and we have seen good results. Okay? So what exactly berberis does acting on the urinary tract? And I told you the main focus will be the kidneys and of course the bladder. Two keywords are used here. The pathology. One, inflammation. Second was calculi. Stones. Good. I'll share a small case. So as a classical prescriber, very rarely I use rare remedies. Okay? Because many kidney stones, they have disappeared, they have gone with constitutional treatment. But we also have something where we use remedies for specific complaints. One day, one fine day, not day, fine night, what happened? One of my receptionists, he had bad pain in the left renal area. Bad pain, bad pain. And here, the knowledge of surgery and other things will play a role. See, from the knowledge of anatomy, there is something called as renal angle, fine? Renal area. So when somebody is complaining of pain there, then you are sure that the problem is with the kidneys. And luckily, this receptionist of mine, in the past he had similar complaint and he had kidney stones. So he was pretty sure, forget about me. He was sure. Fine, sir, this is the same pain I am getting, must be, I have started with stones. Okay. So, left side, bad pains, radiating pains, and that minute I didn't think of anything else. I gave him BERBERIS VULGARIS, 200. One dose immediate, and I told him one more pack, you just keep it. If required, you can use it in the night. Bad pains, and they are very bad pains, fine. It's an emergency. And next day morning, or next day, when I went to the clinic, he came in a piece of paper, he had packed, he had come with a stone. Meaning, after berberis, the first urine that he passed in the morning, he had passed this stone. See the beauty. If he was admitted in an allopathic hospital, fine, forget about the money. Lot of things, meaning, you give this painkiller, IV drips, etc., etc. Or if it is bad, they might even do lithotripsy based on the patient. But see the science our great master, Dr. Hanuman has given. Fine? A holistic science, a simple science. You just give a medicine and, the stone just passes out. It looks very dramatic, no? In lakkondvi, ice such nikal gaya. Right? But it's a fact. It happened. Okay, and I appreciate that receptionist of mine for showing, sir, this is what happened. One photo ಹೊಡೆದು ಬೆಳಿಗ್ಗೆ ವಾಟ್ಸಪ್ ಮಾಡಿಬಿಟ್ಟಿದ್ದ. ಸಾಯಂಕಾಲ ಕ್ಲಿನಿಕ್ ಹೋದಾಗ he just gave us see what came out in the morning. Fine? Okay, so berberis, a beautiful remedy for kidney stones, especially when it is in the left side. We'll discuss more in detail. So, two pathologies that you see here is inflammation and tendency to form stones. Okay? Tendency to form stones. Fine. So, here what we see here is the pains, the renal colic, very important. Any idea what the pains are like in berberis? Pains are radiating. So, pain from here, from the renal area, it is either going down, okay, into the ureter, into the bladder, that's one possibility, or pain from the kidneys going into the spleen, fine, pain from here going into the other areas, like radiating into other areas. So renal colic, you have pains which are burning, lancinating. Any idea what lancinating is? See, it's not simple pick like this. It's a very serious thing. Stabbing pains, piercing pain. It's not like you girls tell, sir, like this. It's not so delicate like this. It's a very deep pain. Stabbing pain, when somebody is stabbed with a knife, it's not the pick. Nobody will kill you with a pin. Fine? Die. No. Fine? Okay. So, lancinating, burning, tearing pains. Very characteristic. And you also have those radiating pains. This is what you have it in the next slide here. Radiating pains extending along the urethra, typical renal colic. Speciality of berberis is pain extending up into the liver, into the spleen, into the stomach. So bad the pain is, it will arrest the breathing. He can't even breathe. He can't even breathe. He's going into a shock. He's going into a shock. Fine? Berberis vulgaris. Okay? Pain in thighs and hips on urinating. He is urinating, but where is he feeling the pain? He is feeling the pain in the thighs and hip. Okay? And this bubbling sensation which is felt in the kidney. Very, very characteristic. Very, very characteristic. Bubbling sensation. Okay? See, this was related to the renal colic, renal pains. Renal pains. Any clarification here? See, please remember the headings under which I am explaining. For you to write in your theory, it will become very easy. Fine? So when they ask urinary symptoms of berberis, you will have to first write the sphere of action. Okay? And next you will have to write what probable problems it can bring up. And then you will have to write the renal colic. How is it? Where is it? What is special in berberis? Okay? And then we can also discuss the character of urine. As a pathology student, having finished pathology in second year, what do you expect the character of urine to be in berberis? Very good. One thing is there can be bloody urine. Okay? Why bloody urine? Yeah, because the stone can cause some damage to the capillaries. Fair, agreed. Then, because of nephritis, there can be blood. Agreed? Okay, more than accurate. Okay, yeah. Will the uric acid tell? Miss Chinmayi, in the urine, I am also coming. How? What is the character of urine? Correct, good. You are right. Go ahead now. See, when the urine will have more of uric acid, more of, that it will be more sedimentous. Sediments. Small sediments irbodu, or the urine can be turbid. What is turbid? Huh? It will not be the normal consistency, it can be a little thicker. Fine? So, you would have studied all this in a pathology. So, when there is a stone, the urine can become thick, turbid, it can be yellowish. Why yellowish? I expected this from you. Why yellowish? Because of its action on the hepatobiliary system. Okay? Probably obstructive jaundice, or you also have clay color stools here. Fine. So red sandy urine, sedimentous urine, mucus urine. Urine looks like coffee, it seems, in berberis. For all the coffee lovers, urine looks like coffee. And the only remedy which has urine having odor of coffee. Many of us like the aroma of coffee, no? So here in berberis, the only remedy mentioned in your materia medica, urine will smell like that of coffee. Clear? We'll go ahead. So we spoke of kidneys, nephritis, renal colic, stones, character of urine, heading should come like that only. And we also had something in berberis. Apart from the kidneys, which is the other organ we spoke? Bladder. Inflammation of bladder. What is the term? Very good. Cystitis. Now what happens in cystitis? There will be burning and pain. Painful micturition. Okay? So a set of things you have here in berberis. Very important for you is the pains which are radiating. Pains which are extending. From bladder, the pain extends to the urethra. Because of the inflammation, you have frequent urging for urination. Frequent urination. Pain in the kidneys before and after urination and frequent urging to urinate. So it's come twice. Yeah, frequent urging to urinate. Cystitis. Okay, cystitis. These are few things you need to remember. And when are the complaints aggravated? The renal complaints are aggravated by stooping, rising, sitting, lying, jarring, or touch. These are all the aggravating factors in berberis. So, sphere of action, pathogenesis, character of pain, what are all the conditions like inflammation, stone, what is the sensation, okay, and the cystitis part and the modalities. All these things you have to write for 5 marks. And the side affinity of berberis is predominantly left side. Left side. That also has to come up in your answer. Left side. Predominantly left side. Left side. Okay. Now the last component of today's class will be what? Clinical indications. Now I have given you berberis. This will be more of an activity. Now you need to tell me berberis na nale practice alli where can we use berberis? What is the clinical utility of berberis? Very important for a third year student. Can I have few from the back? Hudugru, starting nimge. Berberis clinical inale for what conditions can we think of? You know what? Renal calcula, very good, absolutely right. Huh? UTI, urinary tract infection, especially cystitis. Good, very good. Huh? Jaundice ಆಗ್ಬೋದು, good, ಇದೆ. Jaundice, gallstones, good. Hepatomegaly, fine. ಬೇರೆ ಲಿಮಿಟ್ ಟು ಬೆರ್ಬೆರಿಸ್. ಜಾಂಡಿಸ್ ಆಯಿತು, gallstones ಆಯಿತು, ಏನಾಯ್ತು? vocal cord polyp, good. vocal cord polyp, agreed. Anal fistula, gout with this typical urinary complaints. Gout, fine. Arthritis, then yeah, fistula, agreed, good. See, there are a list of things taken from your books. Okay, many you have covered. Lumbago, go back. Okay, lumbago again when the pains are radiating down, you can think of berberis. Lumbago. And gallstones ಆಯಿತು, bladder ಆಯಿತು, kidney ಆಯಿತು, dysmenorrhea. Now again, the indication of berberis in dysmenorrhea, pains which are radiating. Pain from the lower abdomen going to the thighs, radiating pains. You can think of berberis. And leukorrhea vaginismus. The vaginal muscles, they go into spasm. Caution will be difficult in berberis because of vaginismus. Okay, spasm. And fever. See, fever of berberis, it is mainly indicated in intermittent fever. Okay? As a third year student, it is indicated in intermittent fever. They will have more chills, and during chills, they feel the entire bones are cold. Coldness of bones during chills. And fever mainly in the evenings. And mainly thought of in malaria, intermittent fever, with enlarged spleen. Spleen is enlarged, spleen is painful. Okay, in malaria you can think of berberis. Okay, fistula, herpes, acne, liver disorder, yeah, neuralgia. Yeah, this last point, neuralgia of spermatid cord. Okay, pain in the spermatid cord radiating into the testis. Shock-like pains, pain in the spermatid cord going down into the testis. That you have it in berberis. Okay. Yeah, fine. I feel we have covered major. So, any questions before we close? All clear? Okay. So, if all clear, then we will try to have a quick revision. We will try to understand a small activity again. What is the sphere of action of berberis? Mainly urinary, joints, hepatobiliary system. Very good. 3 areas. Okay. And in that, the main area is urinary. Main area will be urinary. See, under clinical, I have missed one thing here. It can be again a very good remedy for flat warts. Flat warts. In warts, we have different types. In berberis, we have more of flat warts. They are not raised, flat warts. In our local language, narulyanti, warts. Fine? Okay. So, one, we spoke of sphere of action. Second, which is the side? Mainly the left side. Okay. And third thing is, what is the character of pain? Radiating, wandering, lancinating, tearing, burning. Okay. And last thing is indication of berberis in kidney stones. Left side with this typical pain. Left side. Character of urine? See, we have more of stone. So more of red sediment or turbid, thick sedimentous urine. And the odor of urine? Coffee. Fine? It will smell like coffee. And it also looks like coffee. Done? Any questions? All clear? All clear? Chalo, if all clear, thank you. We will stop and yeah, nothing. Thanks.